Women also tend to take longer to recover from their injuries. And when you look into women that are over the age of 40, they're more likely to have permanent symptoms as a result of concussion. Again, we don't know why this is, but there's some theories, and they're pretty much the same theories as why there's increased susceptibility for women. Number one, maybe the injuries are more severe. If there's a thinner neck and the head gets hit, maybe there's more acceleration, more force delivery to the head, and therefore a more severe concussion. Theory number two, maybe women are being more truthful in reporting their symptoms. So it's taking them longer to recover because they're still thinking or still reporting that something doesn't feel quite right. Whereas potentially on the men's side, they're saying, I'm fine, and going about their day. Three, hormonal differences. Again, fluctuations around the menstrual cycle potentially may be delaying symptoms or preventing recovery from occurring at the same rate. Again, don't know, kind of mixed on that. And then a fourth one here is that we know, and we already reported this in baseline, that women tend to be higher on the emotional symptom scale, which is your sadness, kind of depression, anxiety, and being more emotional. They tend to be higher on that in terms of baseline symptom scores. So to begin with, if that symptom score or that symptom cluster is already higher, we know that those types of symptoms, such as anxiety and depression, already set you up for a prolonged recovery, no matter what sex you are. So if there's a higher degree of anxiety and depression reported by females prior to injury, then perhaps that is one of a potential cause of symptoms taking longer to recover in women. So those are kind of four theories. We don't actually know what the difference might be. We just know what the results are, and the fact is that women tend to take longer